This is Office RX, where we prescribe solutions for smarter medical practice growth. Brought to you by PAHCOM, the Professional Association of Healthcare Office Management. Are you ready for today's dose? Let's get started. Welcome to Office RX, your weekly dose of insights for medical practice management. I'm Trinity.
And I'm Marcus. And today we're tackling something pretty significant that's been on a lot of practice managers' minds, especially with recent legislative changes.
Oh, you bet. I've been hearing a lot about the One Big Beautiful Bill Act. It just passed, right? What exactly is it, and how might it impact our practices, particularly those smaller ones and rural clinics?
That's right. It was signed into law in July 2025. This bill, H.R. 1, is quite comprehensive. It reduces taxes and it affects spending for various federal programs, increases the statutory debt limit, just a lot of changes across the federal government. For our listeners, especially those in small practices in rural areas, the Medicaid reforms are really key.
Medicaid reforms, you say? I've seen some of the headlines about that. What are the specific changes that practice managers need to be aware of? Like, I know there's talk of stricter eligibility and work requirements.
Yeah, absolutely. The bill introduces stricter eligibility verifications, more frequent redeterminations, and work requirements for able-bodied adults. The Congressional Budget Office, or CBO, estimated that these provisions could lead to millions of people being disenrolled from Medicaid by 2034. And research suggests that when federal funding decreases, states often cut optional benefits first, like home and community-based services, or HCBS. This could really affect our vulnerable patient populations.
Wow, that sounds like a seismic shift. Honestly, and rural hospitals, they already operate on such thin margins, don't they?
How does this bill impact them specifically? It's a critical point. Rural hospitals are indeed at significant risk. Many already face closures. While the bill does allocate $50 billion for a rural health transformation program from 2026 through 2030, which is good for things like workforce recruitment and technology upgrades, the overall projected cuts to Medicaid spending in rural areas could be much larger. It's a challenge to maintain essential services like emergency room care, labor and delivery, and even behavioral health services when facing such financial pressures.
So it's not just Medicaid then. I heard something about Medicare changes too. Could you shed some light on that?
You're right to ask. The bill impacts Medicare as well. It prohibits the implementation of rules that would have made it easier for low-income Medicare enrollees to access Medicare savings programs, or MSPs. This disproportionately affects disabled people, who often have lower incomes. There are also changes to Medicare eligibility for people with lawful immigration status. The CBO has projected significant cuts to Medicare from 2027 to 2034 due to the statutory Pay-as-you-go Act.
That's a lot to navigate for our practices. So what can practice managers do to prepare for these changes and protect their patients and, well, their bottom line?
Proactivity is essential, Trinity. Practice managers need to educate their Medicaid enrollees on how to maintain benefits, like documenting work hours and updating contact information for redeterminations. Clinics might consider workshops or partnering with community organizations. It's about being a trusted community anchor. Also, tapping into resources like PAHCOM, that's PAHCOM, pronounced PAHCOM.
PAHCOM, got it. What kind of resources does PAHCOM offer?
PAHCOM provides a collaborative network offering focused information for small and rural medical practices. They have an education calendar with webinars and training on policy changes, compliance, and operational adaptations. Plus, they offer professional certifications like the Certified Medical Manager, or CMM, and HIT Certified Manager. These certifications can really help managers navigate these complex changes. We'll have links to all these resources, including the articles we discussed, in our show notes.
That's fantastic advice, Marcus. It really highlights the importance of staying informed and connected in these turbulent times.
Absolutely, Trinity. It's about resilience and ensuring quality care endures.
Well, that's all the time we have for today's dose of Office RX.
Until next time.
See you at the forum.